the end of October 2020, President Trump released an executive order instituting the last of the Affordable Care Act requirements, group health plan pricing transparency. The kicker, even though the companies that offer health insurance will have no ability to implement these requirements, the rule assigns them direct liability. You can avoid this issue by taking a few specific actions today. My name is Allison DePauli, and I started Altiqe Consulting to help employers like you take control of your healthcare spend and get budgeting predictability. The happy side effect is better access to high-quality care and lower out-of-pocket costs for your employees. If you like what you find here, subscribe, hit the notifications bell to be notified when we upload new videos. First, let me say thank you to Jen Berman and Jessica Waltman for their article in the NAHU compliance blog for the initial analysis. We'll link to the article in the comments. It's a quick read. The actual rule is 70 pages and is going to produce a flurry of agita and probably a fair amount of litigation. I can just hear it now. But our discounts are proprietary. I call bull on that. You pay the bill, you should know what you're paying for. So should your team. So let's talk about timelines first. By January 2022, that is only a year away, almost all non-grandfathered health insurance plans, as well as employers that sponsor group plans, self-funded plans, must publicly disclose in-network provider negotiated rates, historical out-of-network allowed amounts, and drug pricing through 3 machine-readable files posted on an internet website. The files must be publicly available and kept current. The idea is that this data will be used to understand healthcare pricing and potentially dampen the rise of healthcare spending. Would you be surprised to know I have an opinion that differs just a bit? That's a video for another day. Beginning with plan or policy years starting on or after January 2023, almost all non-grandfathered health plan insurers and employer plan sponsors, self-funded employers, will have to make sure that plan participants can access personalized cost estimates for 500 designated shoppable services before they incur a claim. As with other rules, the hope is that this will help patients be responsible consumers. And honestly, this will be the first time that they have an opportunity to be responsible consumers. Again, all information must be available on a public internet site or on paper if requested. The required information includes estimated cost-sharing liability for specific procedures and conditions, the amount of cost-sharing liability a participant has incurred to date relative to their maximum out-of-pocket limit and any deductible, the negotiated rate the carrier or group plan has agreed to pay an in-network provider for the specific covered services the plan participant is considering. That's a mouthful. The maximum reimbursement amount that the carrier or group plan would pay to an out-of-network provider for a particular service, an explanation of any prerequisite for the person's request. So step therapy, a pre-authorization certification, or anything like that. As well as a notice warning about balance billing to explain that the plan is merely providing personalized estimates and actual costs may vary. By 2024, this requirement will extend to all covered items and services. So this is kind of a big deal. CMS, for providers, for patients, and especially for employers. We've talked a lot about how to pay a fair price for care. We'll link some of those videos below. Those will help you get started, at least have a reference point of where and how to start. And here's what you can do today without waiting for any government intervention. Pay a fair price for care promptly. This not only helps you meet your own responsibilities, it helps providers run their operations. It's easy to demonize hospitals and facilities, but they need enough money to operate and take care of people. Pay fairly and timely. Review your contracts for fiduciary responsibility. Most admin, TPA, and PBM contracts clearly state that fiduciary responsibility is retained by the employer. That's fine. It is your responsibility. Make sure you take the next steps so you have full access to the information you need to fulfill your responsibility. Audit. Make sure your claims payment provisions have auditing terms that are fair to you and allow you to execute your fiduciary responsibility. Remember, ERISA trumps contract. That liability, if you're fully insured or self-insured, doesn't go away. It would also be wise to update your contracts to ask for indemnification from your vendors. If you're fully insured, I imagine there will be a risk transfer mechanism available for a fee. Finally, one of the challenges with getting information and access to pricing is consistency of data. I suspect that problem will not go away. One of the few win-wins in healthcare is that you do have access to tools, both AI and telephonic, to help steer your employees to high quality care. That is one of the few win-wins in healthcare. So if you're an employer and you're interested in solving your budgeting problem and doing a bit better for your employees, and you're willing to do one or two things a bit differently, click the link below and let's see if we're a good fit.